Qualified, professional, and compassionate doctors talking real solutions to real health problems.
On the DocTalk show today, we discuss cancer in children. Our host Dr. Darius sits down with Dr. Jane Balagade Kambugu to enlighten us more.
Cancers are the second leading cause of death worldwide. The story is grimmer in children because cancers are the #1 cause of deaths in children worldwide. So today we want to understand more about cancers in children, and with me in the studio is a senior pediatric oncologist based at the Uganda Cancer Institute, Dr. Balakade Kambugu Joyce, who is going to help us understand more about cancers that affect children. You're most welcome to the show, Dr. Joyce.
Thank you.
And I am your host again for the evening, Dr. Darius Wachi. So let's dig into understanding more about this disease that is causing so much trouble in the young generation. So, Dr. Joyce, once again, we thank you for joining us on the show. And in your field of expertise, you are an oncologist. Help us understand more about these cancers in children. What seems to be going wrong? Why is cancer disturbing so many children?
Cancer in children is now a global priority, as you have said, because it is now the leading cause of death. And the reason that it's a priority is that this death is preventable, because in high-income countries, 80% of cancer in children is curable.
80%,
whereas 80%,
the majority of the cases of the cancers,
yes, are curable in children. But that is in the high-income countries. In low and middle-income countries, this number is less than 30%. In fact, it's about 20% in some countries. And this is because of a number of reasons, which we could talk about later on in the show. And that is why globally now, the international community is rising up to see that we bridge this gap. More importantly, because 80% of the world's population of childhood cancer resides in low and middle income countries, and therefore the disparity is massive.
So we carry a very big burden.
And yet our cure rate is low. Yes. And yet our cure rate is lower than it could potentially be. And some of the reasons why we're having this very low cure rate is, one, children are out there not being diagnosed in the villages and their homes.
They don't know that they have this cancer.
They don't know that they have cancer.
Or the parents can't identify.
Or the doctors in the health centers don't know that it's cancer. Or two, they are misdiagnosed, and this is because of the health system again. Somebody goes to the clinic and they're told, oh, you have TB or you have something else. Or three, the diagnosis is delayed. Again, they remain in the health system, and by the time a right diagnosis is made, it's very advanced. But also there are problems with access, which we can talk about later on, access to care even when they come to a cancer treatment center. And then there are problems with abandoning treatment, and those have to do with many problems in low-income countries and poverty. And then, of course, toxic deaths, because we're unable sometimes to support them the way they need to be supported when they're undergoing these very toxic treatments, and then disease relapse.
What are the common cancers people should be aware of?
In the past, it was lymphomas. These are cancers of the lymph nodes. Lymph nodes are small swellings, like, for example, in the tonsil area here, or in the axilla, the armpits, or the groin. Those are lymph nodes. Okay, so cancers that arise from those lymph node areas used to be the commonest. And Burkitt lymphoma, the cancer that most people are most aware of in children, which causes swelling of the facial skeleton, if you've seen, used to be one of the most common cancers in children. But the picture has changed somewhat, and now we are seeing that leukemias, acute leukemias, are the most common cancer among children that we see at the Uganda Cancer Institute.
So leukemias, we can define it as, in simple terms, the cancer of the blood.
Cancer of the blood, yes.
So it's the most common cancer we see in the Cancer Institute.
Yes. Okay. Followed by the lymphomas, which I just explained about, followed by cancer of the kidney, followed by cancer of the muscle, And then we have cancer that is called Kaposi sarcoma. That is a cancer that's very common in the setting of HIV as well. And very common in the adult population. But in children, it's about number 5.
So the biggest to worry about are the leukemias, the
Yes.
cancers of the blood.
Yes.
How exactly would this leukemia or these cancers, how can one identify that they might be having this cancer? Are there any warning signs that the cancer starts with?
Most cancers in children are not actually preventable. We don't really know what causes cancer in more than 90% of the cases, in spite of intense research that has been carried out up until this time. And so as a result, we don't really have preventative measures in children. So all efforts with regard to caring children are geared towards early diagnosis. And some of the early warning signs, can be grouped into about 5 groups. And one of them, of course, which I have said is 1, seek medical attention for any persistent symptoms. That one I think I need to mention. If symptoms are persistent, seek medical treatment. So, and this doesn't matter what the symptoms are. Is it fevers that are being treated that are not going away? So they treat you this week for malaria. Within 2 weeks, you have another fever. Within another week, you have another fever. Is it weight loss that is unexplained? Kind of seek medical attention for some of these unexplained symptoms. Okay.
Those which are persistent, they never seem
Yes,
to go
that
away.
seem to be persistent. Then 2 are lumps. If you have a lump anywhere on your body, as if you see a lump on your child anywhere, be it in the lymph node areas, so the neck, over the bone, in the stomach, lumps should be investigated. All lumps are not normal. If you have anything like easy bruising that is prolonged, bleeding that is unexplained, you need to go and seek medical attention for things like that. Okay, things that affect the nerves are also worrisome. So, for example, children should not get headaches. Headache is not a common symptom in children and needs to actually be investigated. It is very rare. Or deteriorating school performance for whatever reason, or handwriting, or a child who's not walking or walking unsteadily. So nervous symptoms are not good.
Okay.
And those should tip us off to something going wrong. Symptoms in the eye, like a white-colored eye, especially the younger babies. So that is a cue for one of the very common cancers in the children in the eye that's very curable when detected early. Back pain. So back pain is a rare complaint in a child. In adults, back pain certainly. But a child telling you that my back is sore
It's
it's
an alarming
it's
sign.
an alarming sign, and it needs to be investigated. Perhaps what I need to add is that what puts on a layer of complexity for childhood cancers is that their presentation mimics presentation of common childhood things, and that's what makes it very challenging.
Yes.
Fever, weight loss, pain in the chest. Those are the same symptoms that some child who has leukemia with a mass in the chest is going to present. So the symptoms mimic commonly occurring conditions in children, and that adds a layer of complexity to detecting them early. And that is why the key is persistent symptoms in spite of optimal treatment.
So send in your questions, comments on our social media platforms. You can also subscribe on our YouTube page, that is the DocTalk show. For if in case you missed the show, you can always watch it at a much later time.
You are watching the Doc Talk Show.